Well, CGTN also spoke to Dr. Ahmed Ouma, the Deputy Director at the Africa Centers for Disease Control and Prevention, about the new surge in COVID-19 numbers across Africa.
We are not in a state of helplessness, but it is true that the continent is undergoing the third wave, which is much more severe than the first and the second waves. The reason why we are not in a state of helplessness is because we know what needs to be done. And as Africa CDC, we are supporting our countries to institute those public health measures that will result in bringing down the numbers. And we are also engaging in ensuring that all tools for responding to COVID-19 are made available on the continent.
The COVAX vaccine initiative, some would say, appears to have failed. It has now delivered roughly less than 90 million doses of the 2 billion it was supposed to deliver by the end of 2021. What then is the plan B for the African Union and the Africa CDC?
For us at Africa CDC and the Africa Union, we appreciate the very useful platform that COVAX actually is in as far as mobilizing COVID-19 vaccines for the globe. But within the African continent, we are not relying solely on the COVAX facility. We have also the African Vaccines Acquisition Task Team that was set up by the President of the Union in 2020, His Excellency Cyril Ramaphosa. And that particular task team has been mobilizing manufacturers, negotiating so that we can be able to have vaccines on the continent.
As the Africa CDC, realistically, what kind of support do you need and even expect from developed countries?
What we would ask from the international community is three things. One is make vaccines available. And we are not saying that we want them for free. We are willing to purchase, and it is access now, not access next year or the year after. This is the first thing that I would really like for the international community to be able to appreciate. The second is that the African continent is part of the global community. And if it is not adequately covered by vaccines, then we will still have a global problem of COVID-19 continuing if it is not covered. This is the second thing. The final thing is to let the international community know that a pledge is only as good as when it is delivered. If you make a pledge and you do not deliver, then that pledge is not really helpful to the African continent. The pledge that is delivered is the pledge that is going to be helpful to us here in Africa.